It's WBTC. It's time to talk to the doc, and that's being sponsored by our friends, Mako's Pharmacy in downtown Uricksville, and also by the Twin City Chiropractic located at 205 Grant Street in Denison. And good morning to Dr. McKnight.
Good morning, Kevin.
How are you?
Doing great.
Oh, great.
Beautiful weather, huh?
It is very beautiful. Speaking of topics, today's going to be a nice warm day, I guess.
Yeah, it looks like it's going to be a warm day. I'm going to try to get home and do some things in the afternoon, but it's going to get real hot, I think.
Well, you're walking right into the oven itself by that time.
That's probably the worst time to be out, you're right. But
hey, you're the doctor. I'm just a sideline cheerleader.
Well, I won't stay out long, and I'll have plenty of water, so.
That's the key. Well, today you've got kind of a interesting topic. We've been kind of lounging back, that is, for the last several months. Either folks out there ready to go outside and been having to wait till the green light has come on, or go back to work and trying to get back to a routine of living life.
Right. And it's really interesting. I've seen some people come in the office the last couple of weeks with some pretty unusual, musculoskeletal problems. I think it has to do with inactivity. But, it's funny that just being outside and using a weed whacker or pushing a lawnmower or bending over in your garden all day, pulling weeds or planting seeds or whatever you're doing, sometimes just a little bit of repetitive activity can really flare up musculoskeletal problems. And, a day or two later, you're really hurting in your shoulder or your back or someplace else, and you're wondering, what's happened? Am I just getting too old? Well, it's not really the age, it's the lack of activity, and now you're doing something you haven't done in a long time, and you're wondering how to fix it. So, yeah, I think this is a pretty common problem a lot of people can identify with.
Well, I think for myself, looking in the past, if I had worked a physical job for a long time, then I got a different job, it wasn't as physical, maybe take a couple days off. I usually didn't do that for a long time.
Yeah.
Then I'd be feeling out of shape. But this is a little different situation. This is a situation that you have no choice and go by the rules, and you're in your home.
Right.
And now all of a sudden it's like pick up the speed and get back to the daily routine. Yeah,
and I think that's probably the trigger for a lot of these problems. It's just the disuse, or not being as active as we were, and now we're trying to get outside. It's funny. I think because we've been more isolated and been at home, I see a lot more trash out on the street on trash days. People clean up the house, and the lawns seem much better manicured this year. And when I talk to some of the people at the landscaping centers, they're saying, yeah, they're doing pretty well, and they're seeing a lot of people spending time outside. But that means you're doing things, like I said, you're bending over, and now your back is stiff and sore, or your shoulder hurts, or a number of different musculoskeletal issues that people struggle with. And I'm always about getting to the root cause. Mm-hmm. Okay, why is that shoulder bothering you? What did you do? And as we go through the routine, I was just outside, and I was using my weed whacker. I said, wait, okay, now let's talk about that. Is that when it started? Well, yeah, it was probably the next day. I said, well, I think I know what's going on. You get your arm out, and that shoulder is impinged, and your posture is, you got shoulders rolled forward all day, sitting at a desk or at the table, or sitting on a chair in home with your iPad in front of you. All those things predispose you to a simple problem that maybe last year you wouldn't have had. So we've got to really get to the root cause of this. But once we do, the treatment is usually very effective.
Mm-hmm. Now, with your observation, something that crossed my mind, does it really, I take it, doesn't, in this case, didn't require x-ray or anything of that nature?
No, usually not. Usually just a good history, and they tell us that in medical school. If you listen to the patient long enough, if you ask enough questions, they'll tell you what's going on. And that often happens. You just ask one more question, bang, the light goes on, and it all makes sense. And then your examination kind of confirms your suspicion. So most of the times you don't need an x-ray, even though it might be a joint type of pain. It's a muscle problem. And one of the things I see frequently, in fact, I've seen this a lot the last couple of weeks, is people will come in with pain shooting down their leg. And of course, the first thing you think is sciatica, which is the sciatic nerve coming off the spine. And so you think, well, okay, I must have pulled my back out. But I had somebody come in yesterday and said, I've got this terrible pain. I've had it for a couple of weeks. It's getting worse, going down my leg, the outside of my leg. And I said, where does the pain hurt? And he pointed right to his buttocks. And I said, okay, that's it. It's not the back. It's a muscle in the buttocks called the piriformis muscle. It's all tightened up and inflamed, and it's pushing on the sciatic nerve. So it's not back pain rehab. It's getting that muscle stretched out, getting the pain under control, and getting the motion back. But this was someone who had been on a plane and then had been sitting once he got on vacation at his vacation site, and it all flared up. And so something as simple as a plane ride or a long, ride on vacation can flare up a problem like this, and it's an easy fix if you understand the cause.
And with something like that, does that require prescription or what's in?
Well, yeah, usually when somebody's in pain, you want to help relieve the pain. The treatment for this is to stretch that muscle out. We can talk to Dr. Jakubowski about this in the future because that's what he does. That's how you fix the problem long term. You stretch it out, and then you continue to do home exercises to keep that muscle healthy. But in the short term, the patient's there because they're hurting. So yes, some people can take anti-inflammatories. Those should be short term because they can cause stomach ulcers, they can cause kidney problems. And if you're any type of a blood thinner, you probably should not take an anti-inflammatory like ibuprofen or Advil. Most of the time, though, these conditions respond really well to a short course of steroids. That can work excellent to help alleviate the pain, but of course you can't take these long term because there's other side effects and sequelae if you take those steroids long term. But yeah, there's some great ways to manage this, but sometimes you just got to see somebody and just be reassured that your approach is safe and it's going to get you where you need to be to return to your health.
Now, speaking of painkillers, a quick question here. There's a lot of side effects and lead you down the wrong road.
Right.
And of course, one of the things is just that leads you into if you feel I have to have that, and it takes away the discipline in the muscle in your body.
Right.
In the long run.
Right.
Is that right?
Yeah, that's true. That's if your pain is your problem, you want to stop feeling the pain, and you're thinking, well, painkillers should stop the pain. Well, it might, but most of the painkillers don't fix the problem. They tell your brain, ignore this pain, you don't feel it, but it doesn't fix the problem. And a lot of the narcotic painkiller, they're carefully monitored. They can be highly addictive. They can cause constipation and disorientation. So we really try to avoid those. We use those more for postoperative type of pain and some other chronic pain conditions, but we really want to avoid with these short-term problems the use of those narcotic pain medications because they don't address the problem, and there's a lot of risk to use those even in the short term.
So I take it your patient yesterday is out of pain,
well, I told him in 3 or 4 days the pain ought to be under real good control, but to be able to be pain-free a week from now, he really is going to need to have that muscle worked on.
Right.
He's going to see Dr. Jakubowski, and I suspect in a week or two he'll be back to pretty much normal with some treatment. So yeah, again, treating the root cause makes all the difference.
It does. And of course, like we've talked about numerous times in this conversation, we're coming out of a little different lifestyle where we end up doing some physical labor we may have not done for quite a while.
Yeah, and sometimes it doesn't even make sense. I lift weights pretty heavily a couple times a week, but I was out golfing a week and a half ago with my son. I couldn't even finish the last 2 or 3 holes because I did something to my forearm muscle that was just extremely painful. And I'm still getting up every morning with pain in this muscle near the elbow. I know what it is. It's a tendonitis of a specific short muscle. I'm trying to rehab and treat that on my own, but really the treatment there is going to be with Dr. Jakubowski. That muscle is really tightened up, and it's causing severe tendonitis. And until I fix that with some of his help, if I don't do that, it's going to be months and months before it goes back to normal. And I'd like to get back on the golf course, so I'm going to have to see Dr. J.
Well, I was thinking probably your pride was hurt as well, because I take it that your son may have won this round.
My son is so much better than I am. But I was having a good round, and he was so proud of me, and I'm like, if I could just finish these last 2 holes, I'll have a good score. And I tried, and every swing, it just got worse and worse, and I just had to say, can't do it.
The Arnold Palmer dropped out of you.
It must be it. And I had a big birthday a couple months ago, and I'm fighting it mentally and thinking I can still do these things. You have to be smart. You have to listen to your body.
You have to be realistic, is what you're saying?
Well, realistic too. If you tell me I'm old, I'm going to do 10 chin-ups and say, okay, don't say that to me. But you do have to be careful. You have to listen to your body,
Yep.
and unfortunately, as we get older, you have to listen even better and better to the body.
I don't even think about it anymore. I just threw the towel in. That's all.
Yeah. Well, some people do that.
Yeah.
This is
and
a safe way, I guess.
I don't know. It's the easy way, which I would never have done that before.
Yeah.
So,
Yeah.
if you've been through, like in your son's case, sporting, I'm sure you did sports when you were younger. It's part of the discipline that's
Right.
instilled in you, and, you stay with
Well,
it.
you're right. That's a good point. Sometimes it's that mentality of don't give up,
Yeah.
and when we get older, we're like, well, I'm going to just fight through this, but that can make it worse. And that's the value of wisdom with experience, that you got to listen to what your body's telling you.
Mm-hmm. And, of course, that means I can't look weak in front of my son.
Well, that's
Right.
that's a psychological issue.
Well, that
has
may
to be
be.
addressed before you even go out on the course.
Yeah.
Like he's probably going to beat me, and I need to enjoy this and accept it.
But you don't let him know that.
That's true. You don't. That's a good point. There's ways to out mental him, I guess.
Yes, there is. And that means that teaches him and so forth.
Yeah,
But
yeah. It's fun though to be, this time of year is a great time of year to be outside,
Sure.
doing things that you enjoy doing, and I love the sunshine even though it gets warm. This is just my favorite time of the year. But
sure.
we got to be careful. There's all kinds of things we can get into in the summer that can cause us to have to go to the doctor or the emergency room. So we'll talk about some of those in the next few weeks.
All right, Doctor, it's nice to see you in studio once again. Always a pleasure. And to you and your family, I don't know if you got another golf match coming up, but good luck to you.
Well, thank you. I appreciate it. And I'll say it's nice to be seen.
But not heard, right?
Yeah.
All right. Dr. Timothy McKnight coming in this morning, as he does every Tuesday at 8:30 to talk to the doc. And that is being sponsored by our friends at Mako's Market and Pharmacy, where they take care of any of your medical issues, questions you may have. Mako's offer their customers and the community free assistance with comparing and selecting a plan based on your specific prescription needs. Call Mako's Pharmacy at 740-922-5400. And we want to thank the friends over at Twin City Chiropractic, located at 205 Grant Street in downtown Denison. And they can take care of any of your chiropractic needs, incorporating along with some nutrition directions and what's best for you, and get your back healed and well. Once again, another version of Talk to the Doc right here on Big Hits WBTC.